Welcome to This Explainer. Look, today we're tackling something that, let's be honest, almost every single one of us has dealt with: back pain. It is literally a universal annoyance. But the really good news is that understanding exactly how your back works and how to properly fix it doesn't have to be some big mystery. Okay, let's dive right in. Here's what we're covering today: the reality of back pain, when you actually need to seek medical help, 7 core moves for relief, how to completely master the bird dog exercise, 3 common mistakes you're probably making with it, and finally, your new weekly spine routine. Part 1. The reality of back pain and why the spine fails. So, to fix a problem, we've got to understand the machinery first, right? The Mayo Clinic reminds us that the spine isn't just a stack of bones. It's this incredibly dynamic column. It's held together by a super precise network of muscles, tendons, and ligaments. And right between all those bones, delicate, shock-absorbing discs. If absolutely any one of these interconnected parts gets thrown off, well, you know the result: excruciating pain. But here's a really fascinating insight from physical therapy. You might think you threw your back out picking up, say, a heavy box, but most back pain doesn't actually start with one single dramatic event. Instead, it builds up from small, incremental stress applied over a long period of time. So for the desk workers tuning in, yeah, I'm talking directly to you. That prolonged, slouched sitting you're doing day in and day out, it is literally overloading your back structures, weakening your muscles, and setting the whole stage for injury. Part 2. When to seek medical help. These are the Mayo Clinic's red flags. Before we jump into the fixes, we've got to set up some guardrails. It's the classic question we've all asked ourselves while lying flat on the floor in total agony. When does back pain cross the line from a mechanical nuisance into an actual, true emergency? You know, when do you skip the stretching and head straight for the ER? Well, the Mayo Clinic has very clear guidelines for us here. They warn that if your pain happens right after a severe trauma, like a car crash, a bad fall, or a sports injury, or if it causes brand new bowel or bladder control problems, or if it hits you alongside a fever, you need emergency medical assistance immediately. But hey, if you don't have these specific red flags, take a deep breath. Most back pain, even when it feels super serious, usually clears up on its own in about 6 weeks. Moving on to part 3, 7 moves for back relief. Let's look at the physiotherapy toolkit. Because most of these back issues aren't structurally catastrophic, they actually respond incredibly well to active physical therapy, rather than just laying in bed resting. So here are 7 foundational moves from Total Health Chiropractic, broken down by what they actually do. First up, decompression. Moves like the knee to chest and child's pose gently lengthen your spine and release those compressed discs. Next is activation. Pelvic tilts and glute bridges wake up the deep core muscles that totally shut off when you sit all day. And finally, stabilization. The cat-cow, dead bug, and bird dog build the strength you need to keep your spine safe long-term. Part 4. Mastering the bird dog to build deep spinal stability. Now, out of all those exercises, there's one that is universally praised by physios, but almost universally completely butchered by the rest of us: the bird dog. Before we look at the actual form, we've got to talk about the psychology of movement. As a Healthline analysis points out, usually our bodies will choose the path of least resistance. It will rely on the strongest muscles to do the job, even if they aren't the correct muscles. Basically, you can just go through the motions and feel absolutely zero in your core if your alignment is off. What's really wild about the bird dog is how incredibly simple it looks on the surface. You start on your hands and knees in a tabletop position, and you just extend your opposite arm and leg. Easy, right? But beneath the surface, executing this with a perfectly neutral spine requires massive anti-rotation stability. It literally forces your core to resist twisting, all while putting very, very little compression on your delicate spinal discs. When you finally stop taking that path of least resistance and do this properly, you are firing up an entire symphony of muscles. Healthline notes you should be actively engaging the erector spinae along your back, your rectus abdominis in your core, your glutes and hamstrings, and those deep multifidus muscles that stabilize your spine. If you don't feel all of these working together, you're probably making a mistake. Which brings us to part 5, 3 common bird dog mistakes. Please don't fake the movement. A fitness expert in that Healthline article joked that if they had $1 for every time someone said they didn't feel anything during the bird dog, they'd be incredibly wealthy. Let's audit your form right now. Mistake number 1 is lifting that back leg way too high, like past hip height. When you do this, your lower back arches. Sure, it makes the exercise feel easier, but it completely bypasses your abdominal muscles. The fix? Bring that heel down to hip height. Actively press into the heel like you're trying to push away a wall behind you. That's going to turn on the hamstrings and let you tighten your abs without arching your spine. And that brings us to our second big correction, shifting the hips. When you lift one leg, your body naturally just wants to shift its weight over to the side of the supporting leg, making that bottom thigh look all slanted. Once again, this is just your body cheating. The fix here is super simple. Make sure your supporting thigh is perfectly straight up and down, with your hips stacked directly over your knee. Stacking it like this forces both your abs and your glutes to work so much harder. Okay, mistake number 3 happens at the front of the body, and it's crowding the neck. When reaching the arm forward, people naturally tend to shrug their shoulders way up toward their ears, and it creates all this excess neck tension. The fix for this is a brilliant little mechanical trick. When you lift your arm, turn your thumb so it points straight up at the ceiling. Then just imagine rolling your shoulder blade down your back to keep space between your shoulder and ear. This thumb trick naturally activates your lower traps, keeping the tension exactly where it belongs, in your core, and totally out of your neck. And finally, part 6. Your weekly spine routine. Just 20 to 30 minutes to relief. All right, now that you know exactly how to pull off these movements without faking them, it's time to put the whole shebang together. Action is what actually cures pain. So here's your highly actionable plan. I honestly encourage you to screenshot this slide right now. By committing to just 20 to 30 minutes 3 days a week, maybe Monday, Wednesday, Friday, you can actively fight off the damage of all that prolonged sitting. Flowing through 15 pelvic tilts, a few sets of knee to chest stretches, cat-cows, proper bird dogs, glute bridges, child's pose, and dead bugs, it gives your spine the exact decompression, activation, and stabilization it is begging for. We've covered the anatomy, the red flags, and the exact mechanics you need to build a truly resilient spine. But, the final variable here is you. So I'm leaving you with a challenge. Are you going to continue letting your body take the path of least resistance, slouching at your desk and cheating your way through these exercises? Or are you ready to be mindful of your mechanics, stop faking your movements, and finally put an end to your back pain? The entire toolkit is right here in this explainer. Now, it's completely up to you to use it.